हेलो एंड नमस्कार सभी को। गुड इवनिंग टू ऑल। आप हमें जहां से भी सुन रहे हैं, मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेस लाइव सेशन। In today's session, we are going to discuss about lung cancer and its treatments. So let's get started. Today, we have our expert Dr. Dodul Mondal for today's session. Dr. Dodul Mondal is one of the most prominent and dynamic radiation oncologists from India with international repute who has an experience of working with proton beam therapy at one of the largest university hospitals in the United States. He has an experience of over 13 years. Dr. Mondal, you always bring lots of information to our viewers. It's really nice to meet you virtually. So, welcome to today's session.
Thank you so much. Good morning, good afternoon, and good evening to everyone from wherever you are joining. And thanks for a nice introduction.
So, Dr. Mondal, it's really nice to meet you virtually. So, without further ado, let's start. So, as we are going to discuss about the lung cancer, so my first question is like, what is lung cancer, and what are the primary risk factors associated with its development?
So, lung cancer is something when we see a tumor or cancer arising out of lung. Lung is our respiratory organ, and we know that we have two lungs, one on left side and one on right side. And it has its covering, which we call pleura. So broadly, we say whichever tumor or if a tumor is arising out of the lungs or its pleura as a generic term as lung cancer. But then we divide them as a primary lung tumor and then mesothelioma, which is arising out of the membrane of the lungs. So let us confine to our discussion to the primary lung tumor, which arises from the lung parenchyma or lung tissue, which helps in our respiration, or the tubes, the air tubes, which goes inside our lungs. So there is a large air tube which takes the air and then it divides on left and right side. So the air tube, we technically call them as bronchus, and then it divides further into smaller airways. So the tumor arising out of the airway or the lung parenchyma, we call them lung cancer or tumor. Now, the next question is very important. What are the primary signs for lung cancer? The most common sign is an intractable or a long duration of cough. So someone having a cough which is not resolving for 3 to 4 weeks, someone having blood coming out of the sputum, or whenever someone is coughing, some blood tinged sputum is coming out. That can be one of the early symptoms or signs of lung cancer. There are other signs which develop, which depends on the site of the tumor, what are the surrounding organs which are involved because of the tumor, and the way the tumor has spread. So all these actually determine the symptoms one can have. Like I said, cough with blood tinged sputum, then someone can have a breathing difficulty, someone can have a chest pain, someone can have uh, a pain of some bones or some spinal canal or spine if the tumor is spreading to spine bones. Someone can have a pain over any other part of the body if the tumor is spreading to other bones. Someone can have some headache if the tumor is spreading to the brain. So that depends on the way the tumor has already spread. So a tumor which is located within the lung mostly presents to us with cough with sputum or blood tinged sputum, chest pain, and breathing difficulties.
Yeah. Thank you, Dr. Mondal, for sharing the risk factors associated with lung cancer and providing that knowledge.
I'm a little bit sorry, I have not yet shared the risk factors, so I was just discussing the symptoms. Now, talking to the risk factors, we know that the commonest risk factor is known worldwide that 80 to 90% of lung cancers happen because of smoking. And there is a significant amount of lung cancers which happen in the second smokers. That means someone at home is smoking, the other person second next to him may not be a smoker, but that the smoke is going inside his or her lungs as well. Similarly, we can see in a public place, people sitting in the bus, train, or any other place smoking, and then the person sitting to them, they are also exposed to the similar smoking. So smoking is considered as the most common risk factors for developing lung cancer. The other risk factors can be some environmental factors like pollution, some workplace related risk factors like someone exposed to asbestos for a long time. We call them asbestosis, which can also lead to lung cancer. Then there are some other chemical reagents in the pollution, like we see in the smoke coming out of the smokes of car or in the industries. So they can have potential harmful carcinogenic material, which can also cause lung cancer.
Thank you, Dr. Mondal, for sharing the different types of primary risk factors associated with lung cancer and its development. So moving to our next question. So like you mentioned about smoking. So how does smoking tobacco contribute to the increased risk of lung cancer? And are there other environmental factors that can lead to its development?
Yes,
Apart
so
from
so as I was saying that smoking is considered as the primary or most common risk factors for behind developing lung cancer. And the statistics says that 80 to 90%, and for some specific type of lung cancers, probably more than 90% of the cancers are actually because of the smoking for a long time. It all depends on how much someone is smoking. We call it as pack years. So if someone is smoking one pack every day for 20 years, then we call it 20 pack years. So this pack year has a very strong correlation with development of lung cancer. Someone smoking more will have a higher risk factors of developing lung cancer. Now, other than smoking, the other risk factors, like I have already told you, the environmental pollution. There are a lot of products coming out of, like we call them benzyl products or the benzene derivatives, which are very common in industrial pollutions. Then the second, smoking, which I was telling, that someone sitting beside to a chronic smoker or a smoker, someone is smoking. And then in our country, in India, people cook with coal. So the smoke out of that, coming out of that, and the smoke arising out of the cooking, most of the time the kitchen remains closed and someone keeps on inhaling those materials for a long time. It has been seen that the kitchen smoke is also a significant risk factor for this type of population, right? Very small group of lung cancer patients may be attributed to some genetic risks or some genetic risk factors, some genetic mutation which is present in their body already, like a specific mutation known as BRCA2 mutation. So we can discuss that in some later part of this discussion. But in general, these are the risk factors.
yeah. So thank you, Dr. Mondal. You explained the details very well in great depth. And thank you for sharing the data. So moving to our next question. So what are the different types of lung cancer and how do they differ in terms of their characteristics and treatment approaches?
That's a very good question. Like broadly, we divide lung cancers into small cell lung cancer and non-small cell lung cancers. The small cell lung cancer has been seen to be very, very strongly associated with chronic smoking. Heavy smokers, they tend to develop more small cell lung cancer. Again, these non-small cell lung cancers, they have multiple other types. The commonest ones we say adenocarcinoma and squamous cell carcinoma. There are subtle differences between the way that these three major types behave. Like a small cell lung cancer, by the time they are diagnosed, most of the time they are very, very advanced. Many a times we see that the patient is already having a metastatic disease. That means the tumor has already spread to other organs. So that is how most of the small cell lung cancers present. The non-small cell lung cancers on the other side can present to us in an early stage, and we can detect the tumors in an early stage. The tumors, when the person comes to us, might be in stage 1 or 2 or 3. And of course, there is a risk that the patient can also present at stage 4. The adenocarcinomas, typically they occur in most commonly in women and a person who is a never smoker. So never smoker, women, Asian population, they have a higher risk, or they are the population who develop adenocarcinoma commonly. The squamous cell cancers are again associated mostly with smoking. Prognosis wise, the behavior wise, adenocarcinomas are probably the best among all them. They respond to treatment very well. Mostly they are diagnosed at an early stage. Usually they they harbor some kind of good mutations against which we have some specific therapies available, to which the tumor responds very well. And treatment wise, of course, there are some differences, like most of the small cell lung cancers, when they present to us, they are pretty advanced. So most of the time they may not be cured, and we offer palliative symptomatic treatment in using chemotherapy or some targeted therapy or immunotherapy, giving some radiation to control the symptoms. And if fortunately they come to us in a relatively early stage, then we try to give them chemotherapy, combining them with radiation. And then we also try to incorporate radiation to the brain. We call it prophylactic renal irradiation. So these are all part of the treatment strategy. And then when we see like the non-small cell lung cancers, so if they are coming to us with an early stage, we try to do surgery and giving them a chance of cure. Many of the times that the patient may not be fit for surgery, but still an early stage tumor, then we have a very advanced treatment option known as stereotactic body radiation therapy, a very precise form of radiation that can give or that can offer almost equal chance of cure compared to surgery. Little bit more advanced tumors may need comprehensive management. They might require chemotherapy, surgery, radiation in different permutation and combinations. When the tumor comes to us at a very advanced stage or metastatic tumors, mostly the goal of treatment remains palliative. Nowadays, there is a relatively newer concept that probably in those stage 4 cancers, a small population still might merit a curative approach. A very small amount or small burden of metastatic tumor, maybe the tumor has spread to other organs, but within 4 to 5 small areas, which can be either removed or can be treated with a very high dose of radiation. So this particular setting we call as oligometastatic lung cancer. So again, there is a chance that the person can be given or can be offered a curative treatment. So that's how the in small or in nutshell the treatment strategies vary.
Yeah. So, sir, I wanted to ask, so does this lung cancer can also spread into like other organs?
Yes, that way, or per se, which I always say to everyone, that every cancer has a risk to spread to other organs. It all depends on at what stage the person's tumor or cancer is being detected. A stage 1 cancer has a relatively very low risk. So so-called stage 1, like the way we diagnose them, they have a very small chance that the tumor can be spreading to other organs. And when we already see that the tumor has spread to other organs, we call them frankly stage 4. Like we can detect them with CT scan, PET CT scan, or MRI. That means the tumor has already spread. But yes, any cancer can spread to other organ. And lung cancer is one of the cancers which has very high risk, or is one of the cancer known to spread to other organs very quickly.
So, audience, before moving to our next question, we are discussing about the lung cancer and its treatment with our expert Dr. Dodul Mondal. So you can ask your queries and questions in the comment box. So let's back to our topic. So as you mentioned, Dr. Mondal, the CT scans and the MRI. So I wanted to ask, can you explain the role of these imaging techniques like X-rays, CT scans, and MRIs in diagnosing lung cancer?
Yes, so that's again a very important question, and we need to understand subtle things. Like there was a time when X-ray was one of the most advanced diagnostic modality. Now there's a story probably of 2 3 decades back, and now we have CT scan, we have PET CT scan, we have MRI, and we have HRCT or high resolution CT scan. So these imaging modalities are much more precise, and they give us a lot more information compared to an X-ray. Again, a tumor to be visible on an X-ray needs to be a little bit large in size. Like a 2 millimeter or 3 millimeter size tumor may not be visible on a chest X-ray. But the same tumor or that small tumor can be detected using a high resolution CT scan or PET CT scan. So nowadays, the most common investigations which we are employing for diagnosing and staging purpose are either a CT scan or a PET CT scan, and depending on whether there is a risk of involvement of brain or spinal cord, sometimes, not sometimes, we actually recommend doing an MRI. So MRI has a better resolution to detect a tumor inside brain and inside spinal cord. So for staging purpose, PET CT scan, which is kind of, it's a nuclear medicine scan, where one of the radioactive material is tagged with some molecule, FDG, which goes easily inside our body and tumor cells. They can very easily pick up the abnormal areas in our body, and the tumors kind of, they light up. They're seen as a very bright yellow spots on the scan, and the nuclear medicine doctor can very easily identify where are the areas where the tumor might have spread. So a PET CT scan at one go can give a lot of information showing the tumor presence in the lungs, in the glands, in other organs. But it's not a so good modality for detecting tumors which might have spread to brain. And then where there is a high risk of involvement of brain, then we recommend that the person has to go for an MRI of brain to know whether the brain is actually involved or not. In a resource constraint setting, like the PET CT scan might be a little bit costly investigation. Traditional bone scan using some radioactive material like technetium or sodium fluoride, these are some radioactive materials. They can detect bone metastasis or the tumor present inside the bones very well. So there are many countries who are resource constrained. They can use a CT scan coupled with whole body bone scan. If the resource permits, then probably doing a PET CT scan allows more information, and using MRI depending on the level of suspicion for involvement of brain.
Yeah, thank you, Dr. Mondal. So, what are some the latest advancements in lung cancer treatment, including targeted therapies, immunotherapies, and chemotherapy?
Again, a very interesting question. Let me divide it into two parts, or three parts actually, because in cancer treatment, there are three main pillars. One is surgery, second, radiation, and third, systemic therapy. And in the systemic therapy, then we call them either chemotherapy or targeted therapy or immunotherapy. Now, surgery, it all depends on the stage. And in the surgery, in the surgery, then there are newer developments. Like nowadays, we are using more and more robots. So robotic surgery, many people might have heard about this. So robots are being utilized more and more in surgical field. So the benefit of using robot is they cause less blood loss. The hospital recovery is very quick, and sometimes they allow greater precision for during removing the treatment. Now coming to radiation, in last 1 or 2 decades, we have actually seen marvelous development in the field of radiation oncology. So we now use respiratory gating. That means the radiation beam kind of synchronize with movement of lung tumor, because we know that lung is a breathing organ. And with respiratory movement or breathing movement, lung can move up and down, front and back like that. So the tumor has also a chance to move with respiration. So there is now this new modality known as respiratory gating, which kind of tracks the tumor motion and synchronizes the radiation along with that movement. So the tumor is never missed out of the radiation field. Now, I was talking about stereotactic body radiation therapy, or SBRT. That's again a very novel radiation technique where we give very, very high dose of radiation in either one sitting or maybe up to 5 sittings, depending on the size of the tumor, location of the tumor. And that radiation is quite akin to the effect of surgery. Many patients may not be able to go for the surgery for different reasons, or simply someone might refuse surgery, that I don't want to go for surgery. But still, it's a stage 1 or stage 2 cancer having a high rate of chance of cure. So SBRT is the solution in that particular situation. Of course, in a someone has to be very trained and have to have all the necessary gadgets. So again, someone having a metastasis to brain, but very small in size or very limited in numbers. So for example, maybe up to 4 or 5, we do stereotactic radiosurgery or SRS. So that's again delivery of very high dose of radiation with millimetric accuracy, sub-millimetric accuracy, very precise, very high dose radiation like a spot and not missing the tumor. So these are all like very, very recent advancements in the field of radiation. In last couple of years, we have been hearing about proton, carbon ion. So these are again different types of radiation which give certain advantages over a traditional way of treating the tumor with radiation. Now, it all depends on the resource available, the available resources, the cost, the affordability, the background training of the treating team. So, and which part of the world the person is sitting in. So, all are factors which finally decides about or finally helps us in deciding one particular modality to treat. Then coming to the systemic therapy, like we all know about chemotherapy, we have been hearing about immunotherapy, targeted therapy. So chemotherapy is a traditional way of treating cancers. These are drugs which have the ability to kill the cancer cells, but at the same time, they can cause damage to normal tissues to a greater extent. They can cause nausea, vomiting, they can cause bone marrow suppression, giving rise to low blood counts, more risks of infection. So these are some very known common side effects of chemotherapy. And now we are having newer forms of therapy like targeted therapy, like immunotherapy. So as I was telling that there are different nature or different types of cancer, the adenocarcinomas, they harbor a lot of mutations. Of course, some other cancers can also have similar mutations. Now, when there is a targetable mutation, we prefer to use some kind of targeted therapy, right? So these are specific molecules which are very, very specific in their action in a way that they selectively hit the cancer cells, largely sparing the normal healthy tissues of the body so that the cancer cells can be destroyed, but the side effects are not that much compared to chemotherapy. Immunotherapy is the latest addition to that basket. So it's like some medicines or molecules which increases our own immunity or the immune cells of our body, which can fight against the cancer cells. So it's not like boosting immunity, but it's like these particular medicines use our immune cells to make them stronger so that they can identify the cancer cells and kill them selectively. So these are latest additions and innovations in cancer treatment.
Thank you, Dr. Mondal, for sharing a lot of information about the latest advancements in lung cancer treatment. So before hopping to our next question, viewers, eGlobal Doctors is one complete healthcare platform solutions for all your medical related issues. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. So moving to our next question, Dr. Mondal. So as we discussed about the treatment, symptoms, and risk factors, so how does staging help determine the extent of lung cancer and guide treatment decisions? What are the stages of lung cancer?
So traditionally, all cancers, including lung cancers, are divided into stage 1, 2, 3, and 4. So roughly, we always say that stage 1 to 3 means the tumor is located within the organ of origin, or it has just spread a little bit away from that organ. So like for lung cancer, stage 1 and stage 2 is definitely very well within the lung parenchyma or the lung tissues, which helps in our breathing. And then when the tumors are a little bit away from that and are present in our glands inside chest, we call them mediastinal glands or different other glands. Those will be very technical terms I don't want to use here. But it's like the tumor is not exactly within their site of origin, but has spread a little bit away from that origin, but not outside lung. That you can consider as stage 3. Now, stage 4 nowadays has a little bit variation, like someone coming to us with a collection of fluid inside lungs or pleural effusion, we say, that can be a stage 4. Again, someone coming to us where the tumor has spread to other organs, like it has spread to bones, it has spread to liver or adrenal gland, or brain or any other part outside lungs. Again, we call them stage 4. So every cancer can be divided into stage 1, 2, 3, 4 most of the time. Now, how does it help in decision making for the treatment? Now, barring stage 4, stage 1, 2, and 3, they are considered as curable. So the person has very high chance of cure. The chance of cure is maximum with stage 1 and stage 2. It can be as high as 80 to 90% to 95%. In some series, they have said that 95% patients can be cured when they're in stage 1. The same thing when it comes to stage 3, the cure rate goes down a little bit. It might be 60 to 70% or 75%. Again, when it is stage 4, the chance of cure becomes a little bit lesser. It might be, so in today's time, we can expect like 50% or 60%. That even when they are stage 4, that much cure rate can be expected. It also helps us in deciding or determining whether we have to go with surgery, or we need to add chemotherapy, or we need to give radiation, or you need to use all of them. And then sequencing, how to start the treatment, whether to begin with chemotherapy, then go for surgery, or whether to give with start with a combination of chemo, radiation, and then go for surgery, or to start with surgery and then adding chemotherapy or radiation, like that.
Thank you, Dr. Mondal. So as we have discussed about the stages, types, and all things, so are there any preventive measures or lifestyle changes that individuals can adopt to reduce the risk of lung cancer?
Oh, yes, there is a very simple preventive measure: stop smoking. Cessation of smoking, and a never smoker has a very, very low risk of developing lung cancer, which are mostly coming from the environment. Like I was saying, pollution may be a big factor. Chronic exposure to other kind of smokes like kitchen smoke, exposure to asbestos, right? So those risk factors still might persist, but 80 to 90% of lung cancers are because of smoking. That risk can be reduced simply by stopping smoking. Now, there is a big lobby of tobacco industry. Who is going to stop them? That's a big question. So we need laws. We need to enforce laws against public smoking, smoking in and around schools or educational institutes. So there are specific laws which we need to reinforce them very stringently. Now, the other risk factors which may not be modifiable, like genetic risk factor, I was telling. So we'll come to that in maybe in some later question. So cessation of smoking and stopping smoking is the simple most and single most simple most preventive factor. We do not call the other things, we exactly do not call it as a preventive measure, but screening might help in detecting the lung cancer at a very, very early stage and might give a chance of cure to a greater extent. We can do lung cancer screening by using a very low dose CT scan. That's recommended for high risk population who are smokers or who are being exposed to smoke for a long time. We can use this screening methodology to detect the lung cancer at a very, very early stage.
Thank you, Dr. Mondal, for sharing the information about the lung cancer and genetics affecting the lung cancer. So my last question is, like, what is the importance of a multidisciplinary approach in managing lung cancer, and how do oncologists like you and surgeons, radiologists, and other healthcare professionals collaborate to provide comprehensive care?
But this is probably the best question what we should understand as a whole. This gives a holistic view of cancer management. Now we are living in an era where one person may not do or may not be able to do everything. The things have changed every week, every month. There are so many new information coming in, so many new treatment modalities are coming in, that it becomes difficult for one person to keep up pace with all of the recent developments and do the entire treatment all alone. So there lies the necessity to have a group of doctors, and that starts from the chest physician. Usually they are the first one to have an interaction with them, diagnosing them. Then we, like the oncologists, we have surgical oncologists, radiation oncologists, the medical oncologists. then the rehabilitation or the palliative care oncologists. So everyone has their essential role to play at particular stage. We need to have a very good pathology services to diagnose. We need molecular services, the molecular oncologists to characterize the exact nature of the tumor, to identify the different mutations available in the tumor, and then we can decide which targeted molecule or which targeted therapy we can use. So nowadays, the concept of comprehensive cancer care should have everyone on board, including a radiologist, including a nuclear medicine specialist who will guide us about the stage of the tumor, a pulmonologist who will be helping us in getting the tissue from the lung, or interventional radiologist who also can assist us in getting the tissue for diagnosis. Then for therapy purposes, we need to have the surgical oncologist, the medical oncologist, the radiation oncologist, because the patient might need all of them or one of them or two of them. We need to discuss based on all of the available findings that what treatment is best depending on the stage of the patient, their performance, their condition of general health and all these things. And if the person is coming to us at a very late stage, who are probably not a fit candidate for a very intense treatment to provide cure, we can loop in our palliative care specialist or palliative oncologists who provide supportive care to them. So these are like a holistic approach nowadays. And a center having all of them together on board is probably the one who can give best of the result to the patients.
Thank you, Dr. Mondal, for sharing lots of information about lung cancer and their treatments. So, Dr. Mondal, can you provide a summary on some practical take-home message for prevention of lung cancer to those audience who just has joined us?
Yeah, definitely. So to summarize, lung cancer in most of the time is a cancer of lifestyle, and 80 to 90% of lung cancers, they occur because of smoking. So cessation of smoking and stopping smoking is a single most and simple most preventive strategy which we must adopt. And then avoiding other environmental pollution, wearing a mask whenever we are going out, avoiding kitchen smoke or having good ventilation and facilities in the kitchen so that the smoke can easily go out. So these are simple things which we can adapt in our day-to-day life, and that will definitely help us in preventing lung cancer. We should also think about screening for lung cancer in population who are high risk of developing lung cancer, so that we can detect the tumor at an early stage. And again, the result of treatment will be excellent in them. There will be a very small percentage of population who might be having some genetic factors playing a role. We can identify that particular genetic risk like a BRCA2 mutation by some simple tests, blood test or saliva test, and then probably we can decide about their future strategy. So simple things, avoiding smoking, avoiding pollution is the best way to prevent lung cancer.
Thank you, Dr. Mondal. It's really nice to meet you virtually, and you have shared a lot of information and also the prevention tips for our users. So viewers, if you have
Always
any...
a pleasure meeting you here, and you always ask very nice questions, very important and suitable questions which actually can have good impact in the larger population. Thank you very much.
Yeah. So viewers, if you have any signs or symptoms, there is no need to worry because we are here to help you at the comfort of your home. And you can reach out to experts like Dr. Mondal on eGlobal Doctors if you need any help regarding your health problem or lung cancer. So thank you, sir, for providing lots of information about the topic. I think our audience has...
Thank you so much to everyone for joining and listening.
Yeah. So before wrapping up the session, viewers, if you are looking for an expert second medical opinion for cancer treatment, well, look no further because eGlobal Doctors is providing access to top oncologists, as we have Dr. Mondal from across the world. So thank you, doctor. Thank you, audience. So it's a wrap.